Welcome to Democratic Television, a program of the Santa Clara County Democratic Party that brings insights, perspectives, and attitudes of our always thoughtful Democratic guests. Today we're joined by Lupe Rodriquez, who works for Planned Parenthood Miramonte in an interesting position. You are
I'm the Director of Public Affairs, and I work for Planned Parenthood Advocates Marmonte, which is the political arm of Planned Parenthood Marmonte.
So you must have an extra large business card to get all that in.
Yes.
Well, before we get into talking about Planned Parenthood and its important services and where and how they provide them, let's get to know you a little bit. You are the person who deals with policy issues at Planned Parenthood. But where did you come from? Where did you grow up? Where did you go to school? Let's get to know you a little bit.
Sure. Well, I was actually born in Mexico City, but my family emigrated to California when I was 3 years old. So I grew up in San Jose, California.
Oh, okay.
Went to school there all my life, and then decided I wanted to leave the state for college, and I went to Harvard University, where I did some work actually in neurobiology.
Oh.
A little bit of a departure from where I am now, or difference. But then, decided that, did a lot of work in college on women's rights issues, was the director of a program run by students at the Boston Medical Center, where we worked with women who had just given birth to connect them to resources and services in the community in Boston. These were really, low-income women, new immigrants, women who really didn't have access to services and really didn't know what to do after they'd given birth. And so that was a really formative experience for me in college, and influenced what I decided to do after college, which didn't have anything to do with neurobiology. I decided I wanted to explore this interest more, and got a fellowship to go to Mexico City, where I worked for an NGO called Salud Integral para la Mujer that works in Mexico City and does specifically policy work to ensure that Mexican women have access to reproductive health care services and abortion care. And I did a little bit of work on some of the pre-work for legislation that eventually led to legalization of abortion in Mexico City. So
Wow.
In 2008.
And that's a big deal, and obviously a recent development, and something that exists in the largest city, but not throughout Mexico.
Exactly. In Mexico, some of the work that I did was looking at access issues, not only in the city exactly, but outside of the city, all throughout the country in different states, and looking at how different laws affected women's ability to make the best decisions for themselves and their families. And but it was really interesting work, and that when that was over, I decided that I wanted to again explore the interest further and really see how I might be able to find a career in this back home in the United States. So when I came back from my work in Mexico, I very fortuitously found a job with an organization called Access Women's Health Justice. That's a small organization that's based in Oakland, but does really powerful grassroots work around the state of California to connect women from who are isolated for whatever reason and face barriers to reproductive health care, really helping with on-the-ground work like giving them rides or helping them with childcare, finding housing for them when they have to travel to get healthcare in different cities.
Just really giving them support.
Exactly.
That they maybe couldn't follow through with any of that if they didn't have the ride or the child care or a couple of bucks to get service or whatever.
Exactly. And so that's where I started in this career of reproductive rights and reproductive justice in the United States, and really kind of learning about how the effects of policy play out on the ground, and how people, even if they have rights to services and to care, aren't often able to enjoy those rights because of real life circumstances and issues that they face.
Now, growing up in San Jose, going to school and all that, did you have anybody in your life or teachers, family that maybe gave you a sense that, getting out there and doing all this really important policy work would be a great contribution that you could make?
Definitely. I think my family and my mother, my father have always been really conscious about politics and about our communities and our society, and they always instilled in me, really progressive values, and particularly around women's rights and women's right to make the best decisions for themselves, right to speak up and really make their voices heard, right to information, right to education. And so I was lucky in that way, that I had a really excellent family that was very supportive of my not willingness, but my wanting to go out into the world and really be a leader and be an independent person.
And I assume probably inspire other young women to say this is a great choice. So maybe you were mentored or inspired, and maybe you're doing that for others.
I hope so.
Maybe don't know it.
I hope so. I think that's definitely part of the consciousness that I have in the work that I do, and in the path that I've taken, and certainly for a lot of young women from my a lot of Latina young women, I'm hopefully influencing them to really stand up for themselves and make the best of their community situation and that kind of thing. So.
Well, that's wonderful. So now you work for Planned Parenthood. Where did Planned Parenthood come from? Where was it founded? How long ago? Give us a little history, if you could.
Sure. Planned Parenthood didn't start off by the name Planned Parenthood. It started in the early 1900s, 1920s, around the time when there was a lot of work being done by women to be able to get rights, to be able to vote, to be able to really, again, make the best decisions for themselves and their families. And, it's evolved throughout the years that it's been in existence, and now exists as a large organization that has different affiliates in different parts of the country. And here locally, we have Planned Parenthood Marmonte, which began in the 1990s as a series of mergers of different Planned Parenthood organizations from around the state.
Essentially all providing reproductive rights services and other healthcare services.
Exactly. Really enabling women who have reproductive rights because of the laws that we have to have access to healthcare, access to basic primary reproductive health care, like contraception, like breast and cervical cancer screenings, like STI and STD treatment and testing.
Sexually transmitted diseases.
Yes, sexually transmitted diseases, treatment and testing, also HIV testing and treatment, and also really basic things like blood pressure screenings, screenings for diabetes, and so Planned Parenthood offers a lot of broader primary care than a lot of other healthcare providers, and really I think is expanding to offer services not only to women but to families and men and children, and so a lot of the services are very preventative healthcare that is really necessary for families.
And services that folks don't have access to now. I know in this country we've tried to get universal health care, something that everybody had access to. We're certainly not there yet, and unfortunately there seems to be a lot of fighting about appropriating dollars to make that happen. So it's great that Planned Parenthood isn't waiting around for any resolution of that discussion, but is continuing to support and provide.
Yes, exactly. We've always really worked in places where there's unmet need for healthcare, where people don't have access to other services, where for the reason that they're not insured, they're not employed. Maybe we're really there for them. We're there for every family, every person, every community, really, and we pride ourselves in again going places where other healthcare providers won't go because they're isolated in rural areas, and so I think that's definitely part of our mission to ensure that people have the best preventative health care that they deserve.
So what is Planned Parenthood advocates as opposed to Planned Parenthood? Of course, I forgot to say Marmonte, but is advocates something that exists wherever there's a Planned Parenthood, and if so, what do they do? or what do you do?
What do I do? Yeah. Well, so for us, in our organization, Planned Parenthood Advocates Marmonte, it's simply the political arm of our Planned Parenthood Marmonte organization, which does all of our health care and our education work. Planned Parenthood Advocates Marmonte is an organization that was formed to be able to allow us to promote elected officials, to promote policies, and to educate the public about the importance of electing officials that are pro-choice, that support comprehensive sexuality education, that support abortion access, that really support issues that that are important for women's health and women's rights. And so again, that's the distinction that Planned Parenthood Advocates Marmonte, is a nonpartisan organization, but really allows us to research candidates' backgrounds on on the issues that are important to us. It allows us to educate the public about these issues and to ensure that if they believe in the work that Planned Parenthood does, that they elect the officials that stand with those values. It allows us to also actually educate elected officials and policymakers and other community members about the work that we do, about the educational work that we do, and about the healthcare work that we do. So it definitely gives us a little bit of freedom in that respect, and it's important, I think, for the work that we're doing now to ensure that we can continue to provide the best healthcare for the families and communities.
Well, I would hope that you would find elected officials, regardless of party, being supportive of this work, because I wouldn't think one would have to be pro-choice to say my feelings shouldn't get in the way of what I think, what services I'm willing to help fund.
Yeah, I mean, I think I agree. I think we're definitely looking at and hope to educate elected officials and the public about the importance of the services. And you're right. You really say that regardless of a person's political affiliation or background, that these things are important. That this is basic health care, basic preventative health care, and that it's important not only for the people who use this, who actually rely on Planned Parenthood for the services, but to recognize that we all know somebody who has been to Planned Parenthood, that we all know somebody who has depended on the services sometime in their life, and even if we don't, that we know that our communities are better when we're healthier and when we're able to access care.
Right. Great. Lupe, we're going to take a little break. When we come back, we'll keep talking.
Sounds great.
Hi, I'm California State Senator Joe Simitian. We're fortunate to live in exciting but challenging times. It's a new day for America and for the state of California, and you and I can both play a role through our Democratic Party. Democratic Party is a great way to make sure that the views and values we hold dear are expressed in the decision-making at the national, state, and local level. It's also a great opportunity to spend some time with like-minded folks who are committed to making our community, our state, and our nation a better place. So find the Democratic Party opportunity in your neighborhood, your community. Call 408-445-9500. You can make a difference, you can have a good time doing it, and you can have the satisfaction of knowing that you played a role in this next chapter in American history.
Welcome back to Democratic Television. We're speaking with Lupe, who's a worker at Planned Parenthood Marmonte Advocates, and a pretty darn good one. So you were telling me about the full range of services that you provide, that Planned Parenthood provides here, and I assume everywhere Planned Parenthood exists. Right now, there is debate in Congress and in the House of Representatives, and a real desire on the part of Republicans to defund Planned Parenthood. And I'm sure it's your job to let people know about the kinds of services that are provided and help demystify the services. You mentioned earlier, which I didn't know, Planned Parenthood offers family services and services to men. So could you just kind of elaborate on that a little bit more? And
Definitely. Planned Parenthood throughout the country offers 90% of the services that we offer are preventative healthcare services, and locally 97% of the services that we offer are preventative healthcare. Only 3% are abortion care, and what those services include, as I mentioned, are contraception, preventative healthcare screenings, breast and cervical cancer for women, but also STI or sexually transmitted disease, testing and treatment for both men and women. We also do exams for men, so prostate exams. We also do diabetes screenings, other types of preventative healthcare, high blood pressure screenings for both men and women. Some of our health centers do pediatric care for children, like immunizations and just basic checkups for children. And so, we really provide a large breadth of services for families, not just for women. And so I think that that's something that, as you mentioned, needs to be demystified, and people need to know about that. These are really, really important services that are for everybody, for all communities. And I think, as you mentioned, the threats to defund Planned Parenthood and to defund these services would really be about that. I mean, the money has nothing to do with abortion care. What we're talking about is again defunding contraception, defunding preventative health care like breast and cervical cancer screenings, which are vital for a lot of communities, defunding those care for children, defunding services that again really just prevent catastrophes, prevent chronic diseases, and honestly also prevent pregnancy. I think unintended pregnancies if women
That's
are.
an important point.
I think it's important to note that if a lot of the elected officials that are the Congress members and the senators who are intent on promoting this defunding of our services, they're saying that it's part of reducing abortions in the country. But I mean, what they would do, in fact, is potentially increase the need for abortion if they take away money for preventive care that really helps women who are trying to prevent unintended pregnancies. So I think that that's something that we really would like the public to know, and are I think are mobilizing communities around the state and locally also to just who understand how important these services are and who are angry about what's happening.
Yeah, it just seems to have no place in America anymore to have these medieval concepts take place in legislation and in how our tax dollars are spent. Although Planned Parenthood also gets private support and foundation support, because I think there is a real awareness that you need families to be healthy. You need it for kids to be successful in school, for adults to get to work and be productive and good taxpayers and all that. So it really is so much more. So what would you have done if you had become a marine biologist or whatever it was that you were studying in school?
A neurobiologist.
Okay.
Well, I had the thought of becoming a physician and doing work with low-income communities and preventative health care. So that was the thought.
Oh, well, so maybe that option could still rise up, and maybe not.
Perhaps. No, perhaps.
That's
I think
a lot more
I think
school.
Right. And I'm certainly, I think the work that I'm doing now in terms of promoting this care and really promoting the services that we offer and ensuring that communities are know about these services and know about the care that we provide, I think is part of that, in the spirit of the same kind of work that I wanted to do. And so if that doesn't happen in the future, I'll still be happy with the work I'm doing.
Now, does part of your work include going out and speaking to groups, or will it to get out in front of organizations that maybe say, we don't really know what you do, we'd like you to come educate us?
Yes, absolutely. Part of the work of as Director of Public Affairs is, to talk to the community about the services that we offer to ensure that people know. Again, we don't want to say that that any one service that we offer is is less than others, but we really want to be clear about the fact that we are, our focus is on prevention. Our focus is on really helping communities have the best preventative primary care. And so yes, we go out in the community and talk about that. We also, as I mentioned, educate elected officials about the work that we do, about the programs that we offer. We also have a lot of educational programs, which I haven't mentioned, where we work with teens in high schools to help them, have comprehensive sexuality and preventive education. We also have a teen mothers program where we work with moms who've already had children and help them actually get through high school and get to college. And so there are a lot of things that we do like that. Yeah, and we have programs that help with, women have healthy pregnancies. Some of our health centers offer prenatal care. So, we really want to help people have the best, primary care that they can have. And so I think that that's part of what we do as well.
It's interesting because everything you're saying sounds to me like something that should be part of any healthcare program that we have in this community or this country, whether it's provided by our healthcare providers or not. And again, going back to the origins of Planned Parenthood, obviously all this was missing, and some very thoughtful people said, we better get out there and start making it happen. Definitely. Do you have other kinds of organizations that you work with, like the organization in Oakland where you kind of got your start? Are there sort of sister organizations in the community that do allied kind of work that provide some of these healthcare services, maybe mental health services and all that?
Yeah, we partner with a lot of other community-based health centers that provide services for the community. I think we are part of the California Primary Care Association and do work with again, a lot of like rural health centers and health centers that might not focus necessarily maybe on reproductive health care, might not offer abortion services, but yeah, we work closely with those other community health centers. We also work closely with other community organizations that are working to help teens in high school have comprehensive sexuality education, that are working to ensure that families have preventive health care, that children have health care. We do advocacy in Sacramento on different issues. And so, we're definitely out in the community. We want to partner with folks who are doing great work, and again, be really just an integral part, as you mentioned, of community health, and ensure that that we're to ensure that people know that we're here for every person, every family, and every community.
Do you work with volunteers? Do they play a part in getting the message out and all that?
Absolutely, absolutely. We have a really active volunteer list that come out for things such as, if we have envelope stuffings, as small as that, but also phone banking and a lot of some of the advocacy work that we're doing. In particular, I think around some of the political attacks that are happening right now for funding for Planned Parenthood. We've had really active phone banks for the past month, where we've had 14 to upwards volunteers helping make phone calls to legislators in Washington, and just really active people who are who understand the value of our services and who sometimes themselves have depended upon the care that we provide. So yeah, definitely a lot of really wonderful active volunteers, and who, again, I think because they understand the importance of what we do and again have maybe even gone through our services, are always there for us.
So that's a great point. People have given back because
Absolutely.
You are an ability to pay program, it sounds like. If you don't have money, you're not going to be turned down.
Right.
We have about a minute left. If people do want to get involved and volunteer, is there an email address that you could share that they could go to?
Sure. If anybody's interested in volunteering or getting involved or learning more about what's happening right now with Planned Parenthood, they can contact me at sanjosepa@ppmarmonte.org. So again, sanjosepa@ppmarmonte.org.
Great. Well, that's not as snappy as, something shorter, but that's what it takes to get hold of you. So, well, great. I'm hoping that we will have people that say, I do want to get involved, and this is a tough issue. And I hope that in your work you find legislators, not just because they're mostly all Democrats, are supportive of your work and the work that Planned Parenthood does, both in the community and through Marmonte land and throughout the nation.
Yeah, no, I think we're constantly doing work to educate elected officials from all backgrounds, and yes, I agree. We hope that everybody realizes that community health and really ensuring that people have the best health care possible is an important part of having a good community.
Well, I think if we have people on board, if Planned Parenthood hires well, and I think certainly in this case they have, the word should be able to get out, and other young people can get out and maybe help educate their community, their parents, and we'll have a much better world.
I hope so too. I think that's part of our goal.
Yeah, that'll be the goal. Lupe, thank you very much for
Thank
being
you
on
so
Democratic television. It's been a real eye-opener.
Great. Thank you so much for having me.
Sure.
It's been a pleasure.
Good. Thanks for watching Democratic Television. Give us a call at 408-445-9500 or visit our website, www.sccdp.org. Help make a difference.
Hi, I'm Assemblymember Ana Caballero from the 28th Assembly District. I was born a Democrat, but I've been involved in politics now as an elected official for 15 years, and I'm here because of the Salinas Valley Democratic Club. 15 years ago, they came to me and said, we need you to run for political office, and 20 years ago they said, we need you to be on the Planning Commission. To get involved with your local Democratic club, you can call 408-445-9500. I encourage you, please get involved. We need you.